All right, welcome back to the Morning Blend. A breast cancer diagnosis affects women in lots of different ways, and one of the choices many face is whether or not to have reconstructive surgery once the cancer is removed. October is Breast Cancer Awareness Month, and our next guests are here to talk about different surgical options. We have Dr. Thomas Korkis, Dr. Christopher Hasustian, and registered nurse Allie Myers, all from Plastic Surgery Associates. Welcome, guys. Great to see you again.
Nice Great to be back.
I know it's hard to follow all the pets in costume, but
we do okay with breast implants. That's
okay. That's right. You do something different. You guys look great. It's great to have you here. Let's talk a little bit about this month. It's a special month. It's Breast Cancer Awareness Month. What types of procedures do you do to help women navigate what is a really difficult time in their lives and some difficult decisions?
Yeah, well, we are a group of board-certified plastic surgeons. We have a full practice. We practice all the reconstructive and cosmetic options for breast surgery. Breast reconstruction is a very large part of our practice. 1 in 8 women are getting breast cancer right now, and in the past they were not offered reconstruction. Now we do reconstruction on a majority of the women. Age is not a limit. People are living longer and they're living younger, and there's a lot of different options. The first option, and 80% of the reconstructions are being done with tissue expander, where we put a small balloon behind the skin of the breast, and then we blow it up and then exchange that out for a permanent silicone implant.
Now, does that happen at the time? So if someone has a breast removed, or they have a cancerous portion of their breast removed, does it happen at the same time, or is that a surgery usually people go in for later?
Typically we do it right away. That's called an immediate breast reconstruction. It doesn't have to happen right away, but most breast surgeons and plastic surgeons work together in order to treat that patient at the same time, because we do know when that patient leaves the hospital, they're mentally in a better place because they are in some form of breast reconstruction.
And I think that's worth a lot, because you're already going through so much at that time. In terms of other surgical options that you have for breasts, let's talk a little bit about that.
We can also use parts of women's bodies to make a breast. So we can use the abdomen and the skin and the fat in the abdomen to make a breast. It's called autologous tissue reconstruction.
Now, is this after a breast cancer diagnosis?
After breast cancer.
Just, okay,
yep.
So also after breast cancer if you need to add volume,
exactly.
Is that right?
And then we can operate on the other breast, either do an augmentation, a lift, or a reduction in order to make it better match the other breast.
Mm-hmm. And those are things generally that you talk through before they have the cancer surgery even?
Exactly. And the other thing we're doing more and more of are breast reductions in conjunction with the cancer surgeon, where we are sure to remove the cancer part as part of the breast reduction. And it's a great option for women, especially if they have larger breasts and have always considered breast reduction.
Mm-hmm. I would think so. In terms of what separates you and your facilities from others in the area, why do you think people, if they're going through this type of diagnosis, choose to work with you and choose to have you do the surgery?
Well, Chris and I have been doing this for a long time. We've been in the marketplace for 24 years. We're certified and recertified twice. So we're very in tune with these types of procedures. These are things that we have been doing. We have the ability to work with any surgeon in town. We can go to multiple surgical facilities. In the end, patients sometimes get tired of going to the hospital. We do have our own Medicare-approved operating room right on site where we do all our cosmetic surgery. So that means we can do insurance cases there. So if patients really want to get private, we can finish their reconstructions at our facility, and it's very, very nice for the patient.
Yeah, it's a spa-like atmosphere.
Very
it's absolutely beautiful, and it feels a lot different, I'm sure, for patients to be there versus a hospital, like you said. What is the process like for someone who wants to see you and wants to just kind of understand what their options are, what might be right for them?
Well, when the patient calls, we schedule an hour consultation with either of our physicians and a nurse. And it's really a comprehensive consultation. We tailor it to the patient's needs, discuss everything from all the benefits to the risks, so you're very informed when you leave. And whenever we do surgery at our facility, we always have you come back for another hour meeting with one of the nurses. So we go over everything again, answer any questions, sign consents, things like that. So the day of surgery, we just move forward.
I think it's wonderful too that you work closely with the physician, the surgeon who's treating the breast cancer, because I think that team approach probably appeals to people because they feel like you really know what's going on with them. And I'm sure every patient wants something different.
Yeah, it's one nurse, one patient. I mean, that's what it is. Every patient has an assigned nurse. They become good friends, and it makes them feel very, very comfortable.
I think that's fantastic. Tell us about the special pricing you have, because breast augmentation is a very popular procedure, right?
Yes, we do a lot of cosmetic breast surgery as well as the reconstructive side. Of course, that's self-pay. That's considered cosmetic surgery. The insurance company will not pay for that. Because we have our own facility, we can control our costs and pass those savings on to the patient. We do a tremendous amount of breast augmentation, and we're able to do it at an extremely competitive rate.
Yes, we're doing a breast augmentation right now for $5,900, and that's an
I was
all-inclusive
hoping you'd
fee.
get specific about the price. So $5,900
Yes.
sounds like a lot less than what, if you've done any research online or you've ever talked to other places that do augmentation, that's a very good price.
It is, and that's, like I said, all-inclusive. So your surgeon, your board-certified anesthesiologist, your silicone implants, and all your post-op care is included in that as well.
Nice.
That's incredible. And you also have a Get Even Peel event that we're going to talk about that is happening this week, this Thursday, October 19th, right?
Correct. This
Okay.
Thursday. We do have a few spots remaining, so if you're interested, they are going fast. So please give our office a call.
Yeah, I know you want people to reserve a seat, which is fantastic. Reserve a spot. It's the spot at Plastic Surgery Associates. It's their Get Even with Your Skin VIP Peel event. It's happening again this Thursday, October 19th. You can reserve a spot by calling 262-970-5600. You can also visit them online by going to cosmeticsurgeryplus.com. And again, a reminder that breast augmentation special that they're running right now is $5,900. It'd be great to get a consultation to understand your options. Call 262-970-5600, that number again, or go to cosmeticsurgeryplus.com.